Hey, Richard, thank you for coming in. You really have just a marvelous background, particularly in imaging. You come from the retail space where imaging makes a big difference, and in terms of how that maps to a person's sort of physique and things like that, particularly in the clothing industry. And when you got into the medical side, you realize there's a gap in that something called the body mass index wasn't really a great way of capturing, and it's like dates to something like the 1830s. And you thought, there's a problem. So you spent a lot of time and energy and research looking at something called BVI, and now you've got body volume index, and you've been able to pick up quite a bit of support from various different entities. So we're going to mine some of that, journey. So thank you again for coming in.
Oh, yeah, it's a pleasure. It's nice to talk to you about BVI, Stephen, because yeah, as you say, BMI was invented in 1835, and I don't think there's many things that we still use from 1835. And BMI doesn't take body shape into account at all. So when I found that out, I thought, well, surely there must be a better way of doing, measurement for healthcare than something as old as that just uses height and weight. So yeah, BVI does that and fills that need.
Okay, so let's do a little bit of historical discovery, and we have done a prior interview, so the audience can search for your name and the interview lists and the various channels on the prior interview where we looked at the inflection points of who you are today. So we're not going to go over that same territory, but we should encapsulate sort of the journey that got you into BVI. And so can you talk about that, but maybe in 2 or 3 minutes, so not an extensive sort of narrative, but a short summary of how you got into imaging, um, applying that to in the retail industry, and then how you transition that into the healthcare field, and then we'll walk through that journey and then where BVI is today.
Yeah, no, absolutely fine. I think where the imaging started was in retail, as you say, with clothing. And retailers, like all big businesses, have to, increase their margins and reduce their costs where they can. And returns for retailers are a massive problem. So what we did way back in the sort of 1990s is we measured people using full body scanners to measure mean value body shapes of their customers. And the reason that migrated into healthcare was when we did a big project for Marks and Spencer's, which is a big UK retailer, on children's sizing. And people started talking about childhood obesity. And I thought, well, what's that? Yeah, I never even really heard of it before. And then I found out it was measured using the body mass index. And that's when I suddenly realized, well, that can't be right because children grow up and they grow sideways often at the same time. And you can't have height and weight as a measurement for children when they go in two directions. You can't have two variables to measure something. So that's when we first started looking at maybe changing the technology to work for healthcare. And then we started looking at volumes and different volumes and working out where the weight was on the body. And that's how the journey started. So, yeah, way back in 2004, we sort of migrated the technology over to healthcare.
So, can you talk about how that research proceeded initially, and then we'll then go so from a historical perspective, some of the people you approached and you got support from them. So, first of all, that migration into and the type of research you conducted.
Yeah, no, I'm really pleased you asked that because it isn't common knowledge, but actually the first people that we reached out to were the Department of Health in the United Kingdom, the government, if you want. And then we also reached out to the Centers for Disease Control in Atlanta, um, basically to get the view from the top of what we were doing and whether it was the right thing to do. And I think both those organizations were supportive and said, yep, this is needed and we need something better than BMI. And that was a huge sort of reassurance factor that we were on the right lines. And I think Emory University, who are also based in Atlanta, there's a wonderful guy called Jeff Copeland, who was the former head of the CDC under Bill Clinton. And he introduced us to the then head of the CDC. And likewise, in the UK, we had the Medical Research Council who introduced us to the Department of Health. And those organizations gave us the reassurance of knowing where we could kind of start. So the next stage was them involving the best people in the world to help us develop it. So we got the Medical Research Council in the UK and Mayo Clinic in Rochester, in Minnesota. So that was in 2006, 2007. To start off working out, well, where do we start? If we divide the body into sections, how do you divide it? And then what happens with that data? And how do you make sense of that to make sure that, the really obvious stuff, like people who got too much around the middle, like me, as opposed to someone who's too athletic, is really obvious. But a lot of healthcare is designed and has different nuances, particularly between different ethnic groups and between men and women. So we had to try and work out all that. And so we got the Medical Research Council and Mayo Clinic involved to help us map that process out.
And then so did you get funding from the medical government bodies and then also other sources?
Yeah, we got government funding predominantly from the UK government. We got in-kind contribution initially from Mayo Clinic because it took a while to get the funding through for them. And then we raised some private investment and some grant investment from the European Union and from the UK government to fund that. The research and development phase was complex and took a long time because we wanted to make sure we got it right. So we had to not only deal with the technical side, the volumes and using 3D technology to measure that, but then we had to get the body composition correct. And to do that, we used MRI scans and we used full body MRI scans, which, when people talk about body composition, they tend to refer to what are called DEXA machines, which are predominantly for bone density, but they're much more prevalent and far wider used than MRI. But we basically ended up with the largest collection of MRI full body data in the world, and then used that through machine learning to come up with algorithms looking at external body shape and volumes through to body composition. So yeah, that took a while, and then the next big leap was not down to us. It was when a new machine came out that we could use differently to a full scanner, which is the smartphone. So in 2011, we then migrated the technology from the full scanner to the smartphone. And then we released that in 2017 with Mayo Clinic in the US. So yeah, as the technology evolved, and I don't need to tell you or anybody else listening to this what the smartphone is able to do now. It basically covers every single thing that we used to use different devices for, telling the time, telling you where to go on a map, everything else in between. So we were able to use the camera in a smartphone in the same way that the cameras were used in combination in the scanners.
But that refining of that process, so what you're indicating is you got all of this tremendous amount of data using MRIs and other kinds of technologies to map how the body's, formed in essence, right? The composition of the body from body volume to abdominal volume, fat distribution, looking at all of these different aspects of the body using traditional techniques and then using machine learning to make sense of all of that data to kind of maybe categorize it and see the patterns between that data and then the data that you could get from, let's say, as you indicated, from a smartphone, and then showing how there's a mapping between the other kind of scanning that you did and then what you can get from an optical base 3D data, and you were able to then encompass that into applications, right? And so did I get
Yeah.
that right?
Yeah, no, you did. You're absolutely right. And I think that's why it took so long, because if you think about the human body as an object, it's not a box, it's not a Coke can, it's a very flexible individual piece, which is very unique to every single one of us. And it moves. And because the human body moves and it expands and contracts, it has all different kinds of permutations, which are very, very difficult to understand. So going back to what we found out about childhood obesity and how BMI just does not work for childhood obesity because it's two variables, we had to, the only way of measuring the difference in something is to measure a variable against a constant. So the way that we took this approach was to look at the human body itself as being the constant and the different components of the body being in different parts. So, for example, every single one of us around the world has the lungs in the chest. Every single one of us has the liver and the kidney in the abdomen area. Everybody has bones that run through our limbs. So everybody has the same parts in the different parts of the body. So that was our starting point initially. And then from that, we had to work out what the variances were. And then if someone had an increase or decrease in weight, what was that extra weight? And if it was muscle or fat, and what differences that was. But one of the most interesting things was finding out, for example, if you had a comparative volume between the chest and the abdomen, the chest has the lungs in it, which weigh significantly less than a lot of the rest of the body because they're full of air. So all of those different aspects we had to take into consideration. But yeah, so it was very exciting to do that. And obviously, we can't, there are some things we just can't do. For example, genetics, to a certain extent, diet, you can see the effects of those, but you can't actually measure them from a photograph, but you can measure a lot of data that, using the right source material, you can do correctly.
So let's bring us up to the present. Where are you with your body volume index? Can you talk about the different entities that are supporting it and how they're supporting you? And then
Yeah,
how,
yeah, very much so. I think I'm very proud to be able to present and talk to you about this, but it wouldn't be fair to not give credit to the 60 organizations around the world who have supported us with validation, with testing, often free of charge. Um, you know, People that have advised us. These include government bodies, as I said, the CDC in America, the European Union, about 12 government bodies in the UK, including the NHS, and then a number of universities that have done testing of the algorithms and made sure we got this right. And that is incredibly humbling to know that there's that amount of support to get that right. Where we are now is that effectively BVI is delivered through for those that need to track individual changes in body shape through an app called MyBVI. And that's got particular significance now because of the sort of upsurge in GLP-1 medication. So weight loss drugs have really just taken off in the last 2 or 3 years and are here to stay. And what that's done for us is quite a strange thing we could never have predicted, which is kind of shrunk the time frame of when people's bodies change shape to literally a few weeks, not a few months. And it's also not a self-administered process. Someone can now see quite a drastic change in their body shape just by taking a pill or injecting one of the GLP-1 drugs. So that has really changed the need for something there. MyBVI does that. And then from a platform basis, we've delivered an API that allows anybody to actually integrate this data, body composition and other metrics into their own platform. And we've got a number of clients who are doing that, who are providing weight loss services or fitness advice or body composition. So for those people that need body composition data but don't want to use a machine, then they can use an app and integrate that through the API. So it's very exciting. And I think, given your background, I want to just explain also what it does for AI, because what AI does with this is provide provide a much better starting point from which to get better insights. BMI doesn't provide any starting point. It was designed in 1835 for populations, not for individuals. So what BVI does is get a better starting point, and then using all that data, it allows AI to find relationships between the human body that perhaps we didn't even know were there. Um, One of the things that often intrigues people when I talk about it is the fact that, I know it sounds a bit strange, but the forearm, from the crook of the elbow to the wrist, is in most people the size of their feet. And so you would never look at that and think, well, that's the size of my foot, but it is the size of your foot. And so there's relationships between the body that relate to other parts and predictive health that AI could, provide a really positive impact to show insights that we just couldn't just tell from the data. So that, I think, is for me the really exciting part. Where going forward, people are using our data to provide better insights using other data they've already got on existing patients.
So, are doctors recommending then the BVI? You talk about different organizations. You had earlier done work with the Mayo Clinic. Is that continuing? You talked about the National Institute of Health in the UK and the sort of the medical ecosystem in the UK. Are you finding adoption like in Canada or the Commonwealth countries? What they call the global majority, for example, in Africa and other South America and other parts of the world. How are you finding that this is scaling?
It's interesting. I've got to be careful not to betray any confidences, but what I can share with you is the fact that we have done trials supported by the World Health Organization in Africa and India with malnourished adults and children in areas where they have smartphones, but the internet perhaps isn't too viable, but actually probably less so of an issue now. We have got some of the larger government and representative agencies in the US and in Europe and in other areas looking at this. The beauty of the API is it allows them to integrate something into their existing system, and there's a nominal charge just to cover the server costs, and that's it. And the system we built it to be completely scalable because we were asked to. So it can literally measure millions of people at the same time. And all credit to Apple and to Google and to Samsung and all those organizations that have created the smartphone, because without that, we couldn't do this. There is no machine needed, but people can actually use their own device, and people can actually use the systems they're using for other organizations with our API embedded into that. So, yeah, it's not, I'd love to say that we planned that all out, but we were just lucky that the smartphone came along and the cameras and the depth sensors in them are now so good that we can do what we did before using a full body scanner using a smartphone.
So did this requires like FDA clearance and things like that, or how do you not have sort of some of the regulatory authorities, impacting you or having some governance over what you're doing? How is this positioned?
I'm pleased that you asked that question because one of the first things we did when we had the smartphone-based application is we asked the FDA to review that. And they reviewed it and believed that because it is a measurement device, that it was a general wellness product, not a medical device, because we are measuring people. You're producing an output of measurement. Where a doctor or another physician or a healthcare professional advises someone on their health and takes other data, blood tests, previous medical history, that sort of thing into account, they're providing a prediction of health that perhaps does venture into a medical device or medical opinion. In our case, we're just providing a measurement, just like a waist circumference or a hip circumference or a number on a ruler. We're providing an output of total body fat and visceral fat, which is the nasty stuff around the middle, and waist to hip ratio and waist to height ratio, which are measurements. So, yeah, we do have that sanctioning or approval from the FDA to proceed on that basis, and we have similar approvals from the MHRA in Europe that mean we have, that ability to deploy that in a very general way, which is nice. It's like a weighing scale. If you go on a weighing scale, you get an output of data of total weight. What BVI does effectively is provide partial weight information, so where the weight is on the body. So that's the difference between the two. BMI is total weight to height. BMI is partial weight.
So let's take this further then. I mean, I can go to the doctor, I can get weighed, and I can get my height taken, and then I can on my own even do research. And being a certain height and a particular weight, I could say, that can maybe give me a risk of this or that just on my own. I can research that, or the doctor could come in. I could see the doctor and say, oh, this is there's been a change in your weight, and
Yeah,
they could look at me physically and they could say, hey, this distribution of that weight is putting you at risk for the X and Y. And you have an app, right? A MyBVI app in
yeah,
iOS.
MyBVI app. Yep,
Yeah, you have the same thing in Android. So the system can use a smart camera or tablet basically to you can do your own scan, and by doing so, it captures this ability to give a sense of total volume, abdominal volume, of fat distribution. You talked about this already, visceral fat levels, uh,
yep,
weight to height ratio, body shape classification, and then this personalized cardiometabolic health risk prediction. So, in providing that prediction, I guess then you'd have the qualifiers, please see your doctor or something like that, right? It's like
yeah,
I have a smart watch, and that smart watch gives me all sorts of data, and Apple gives you kind of generalized sort of indications from that data, like even mapping
yep.
my sleep. But then I guess you have to have qualifiers in there saying then you should see your doctor or something like that. How does that work?
Yeah, I'm really pleased that you've asked the question because this is not designed to take away the insights of a medical professional. It is designed to assist that medical professional with having a better starting point from which to assess that patient's health. The MyBVI app allows patients to track their own body shape over time, and they're in control of that process. And I think where we've seen real interest in that is, as I said, with the GLP-1 users who are taking Wegovy or Ozempic or Manjaro, and those are creating quite a dramatic effect in some cases on their body shape. So with those drugs, there's an eligibility issue to start with, and then there's kind of an efficiency and expediency issue of when they use the drugs. So, I mean, just going back to the eligibility, I mean, at the moment, BMI is being used to decide whether people should be prescribed those drugs or not. And that is so fundamentally wrong because BMI doesn't actually take into account body shape at all. So you can have someone who is underweight or overweight using BMI, but they've got the weight in the right or the wrong places. And that's what this does. And what you touched on there is the BVI risk indicator for metabolic risk, which was validated by Mayo Clinic over 10 years, I think, 1,200 patients. And they published a paper in 2024 comparing BVI to BMI for metabolic risk prediction, and BVI came up significantly better because effectively it measures where the weight is, not what the total weight is, which is all what BMI does.
So how do you sustain what you've done? I mean, you've got so much investment, and other people have co-invested in essence
Yep.
by providing grants and research funding and things like that. How do you sustain this thing, what you built, so that it continues on? I mean, is the app? It sounds like the app. Do you pay for the app, or um,
Yeah, I think it's free for the I think it's free to use until you want extra data. And it's a nominal amount a month. I can't remember how much it is, but I remember it's about 100 times, 100 times less than somebody's paying for the subscription on the GLP-1 drug. So I think that was where the kind of mindset went. So there's obviously server costs that are involved behind that. We have had a lot of investment, both public and private sector. The public investment is long-term, designed to provide something better than BMI for the world ongoing. Financially, the investors, one of our investors, I won't mention them by name, but they came up with quite a funny comment when I asked them when they expected a return. And they said, well, I've just invested in an oil rig and it's traveling at 5 miles an hour from one part of the world to another part of the world. And I won't see my investment until that oil rig is set up and ready to go. So I see BVI as a long-term investment. And I think that, I can't really divulge too many of the public sector finances that have gone in, but it's a huge amount of money that actually is already being assigned for BMI data collection. So it's not actually new money, it's money that's been reassigned that is from manual to digital data collection.
So it sounds like insurance companies and big healthcare providers would be interested in getting their base using your BVI. And uh, are they mandating or suggesting, for example, doctors out there use this technology or clinics use this technology because it's gives superior information?
Yeah, I'll answer the insurance question in a minute, but before I do, just so everyone is absolutely clear, to get the data that we're talking about here, all that's required is two pictures from a smartphone. So a front picture and a side picture, that creates a 3D model. And then from that 3D model, you can get all the measurements. So it's that simple. Where we definitely have an interest from insurance companies because their initial baseline requirement is to predict the future risk of someone and to assign a premium to that person based on that expected risk. And obviously, BMI doesn't really work. It was never designed for individuals, it was designed for populations. And I've read the book by Adolphe Quetelet, who invented BMI in 1835, and he actually admits in it, he says, I've created something as a starting point. It's not a full stop. There will be better things that come along in the future, and investigating how the organs change in the body is more important than what I've done. And here we are in 2026, still using BMI nearly 200 years after he invented it. And I think, you know, I find it just fundamentally wrong that insurance companies aren't are charging people often too much money because they're not assessing people properly. And there was a case in Australia where a man was given an insurance premium and told his BMI was too high, so he should go and exercise more. He went to exercise more because muscle weighs more than fat. His weight went up, and the insurance company charged him more money. And he sued his insurance company and he won. And, I think we all need to just grow up and just realize that BMI wasn't designed for what it's being used for. And this is designed specifically to fill that need of having something that's better for predictive risk for the individual. And the insurance companies, are slow to change. But, I think there's genuine interest in that sector because they, like a lot of other people, need good data to start from.
So what you're saying is, smartphones have quite a bit of resolution capability. They're widely distributed. They're very inexpensive today. And just by taking a couple of pictures of your body, you can get things like body fat percentage distribution, visceral fat level,
Yep.
abdominal volume, waist to height ratio, body shape classification, and then a personalized health risk prediction, which you can then discuss with your healthcare provider, which would always be a recommendation, right? You're always working with your healthcare provider. Been the adoption then? Do you have an estimate of how many people have downloaded the app? Is it growing? Is the adoption across different parts of the world growing? I mean, I can see this being a very, like Asia is very kind of health conscious. Why, is
Yeah.
this being adopted in Asia? Because it's an app. India has 1.4 billion people. Why not have 80% of that population using your app? I mean, it's simple. So,
Yeah.
what's the adoption, or what are the challenges for adoption?
Yeah, the adoption, the app is exciting for someone who wants to monitor their own weight, but actually the real adoptions happen with the API because the API allows anybody with an existing platform to integrate body composition data. And literally, some people have done that, and you wouldn't know it's our product. But they've done that, so they've got the body composition data alongside the other data they're collecting. One interesting use case we have is actually a large corporation who have using this to help their own employees avoid sick days and be fit enough to do. They've got a lot of people that are doing very manual work, and they can't, the cost to that business of having people that are off sick because they have bad backs or they're too overweight and they haven't managed their own weight properly, allows the organization to nurture and work with their employees to do that. So that is a system that's embedded into their own HR platform. So I think that's where the real adoption is. I think why not asking everybody to flick a switch and turn over from BMI to BVI, but to use this new data set, a new method of collecting body composition metrics and other data in a more proactive way to fulfill the needs that they currently have anyway.
So, I mean, why are there phone companies? So why aren't they knocking on your door? So there's two kind of classes of phone companies. There's the telecom companies. It'd be a natural add-on for all of the telecom services for telecom companies.
Yeah.
So that's kind of one marketplace. The other marketplace is the people who produce the hardware, all of that sensing stuff that's out there. Why are they adopting? Is Samsung adopting? Is Apple interested in knocking on your door? How about some of the electric vehicle providers? A lot of cars now have all these sensors. Why don't you just walk in front of your car sensing devices, the cameras everywhere, and it just automatically is able to get some kind of capture all of the devices that are out there. You could even have this on kind of like a population health base with all the scanners
Yeah.
out in public. So are you getting some inquiries from these different
Yeah.
or
Yeah.
even banks? Why don't banks provide this? Because a lot of banks provide additional services for their consumers, right?
Yeah, I think what's really interesting is that I think the reason the API has taken off is because the API takes about 2 days to implement. For anybody with reasonable technical knowledge can do that. And I think the real problem we have with BMI is so simple. You just need your height and your weight, and you've got a number. So that's so simple. Whatever we do is always going to be more complex than that. But the added value that BVI can bring over and above BMI is enormous. So therefore, if you're able to take our technology and integrate it into an existing platform, it becomes a lot easier to kind of manage for people, and the added value then becomes so much more beneficial. It's like sort of taking that extra journey to go to a restaurant which is 10 miles away that is so much better, but you'll do it if you feel you want better food. And I think BMI, the problem we have is it's so simple, and People love simple. Anything that's quick and easy to do, they will migrate to it. Um, but now I think the technology is so advanced and so scalable that actually measuring populations is now possible. I checked with our tech guys the other day and I said, can we measure 1 million people a day? And they said, yeah, no problem at all. The system won't break sweat. So that's a nice position to be in. And I think the other thing that is worth sharing with you is that, and this is where our AI comes in, we have migrated what we call our retail system into the app. So every time someone's measured, we actually measure about 150 measurements of the human body. We don't display them all, but we can. And that's where I think AI has got such benefits long term, because there will be relationships between people's bodies and their ethnic background and their ages, and men and women and different populations around the world that we just don't understand. And that's where AI really comes into its own. It does what I just mentioned. It makes it easier to come up with an answer if you give it raw data that's robust enough. So I think we do have genuine interest from people that can deliver on that kind of scale population wise. And you're right, whether it's a car, whether it's a computer, whether it's a smartphone, most devices now have connectivity to the internet automatically, and they have a camera or data transfer in some form that allows that data to be shared and integrated with other data about that person.
So we're down to the closing minutes, let's say 3 or 4 minutes. Do you have some really interesting anecdote or maybe or stories you can tell, narratives where really made a difference? And that's kind of one question. The other question is, do you have some really breakout area which will come it's just on the horizon that will scale this even 10x within the next year or something like that? So let's talk about those first two questions. Like some anecdotal areas. Like I thought your indication that this part is like the size of your foot. I mean, or so this reimagining, what that means. Is there some stories you can tell that with the audience will think, oh, that's novel. I didn't hear that. I didn't know. And that's really interesting.
I think, yeah, it's a very interesting question. I kind of think when I think back 20 years ago to when I came up with this idea, and I thought, how the hell am I going to do that? Um, I never once had any doubt in the idea, and I had no doubt that it was better than BMI. And I couldn't believe that all of us around the world are being measured by something from 1835. And yet, I think where we are now with technology, with artificial intelligence, and I think everybody has a humane and human side to them where we all want the rest of us to be healthier and be better and have good lives. And I think that's a very underlying element in all of us. And I genuinely did this to try and see if we could do it. And we have done it. It was never done to make any money. It was never done to somehow, kick BMI into touch. It's meant to be an improvement on something else. And I think, often I talk to people about the car industry and how the car industry is very clever at getting you to migrate to the model up from the one you actually went into the car showroom to look at. And that's because as human beings, we always migrate to the next thing we'd kind of like to have that is just on the horizon. And that's a very human element that covers us as human beings and has done for literally thousands and thousands of years. We always want to improve things. We want things to be better. And I hope in a very small way that with the 60 collaborators that have helped on this, that we've done that. And it's very, very humbling and very, good to be able to talk about that, because I don't often get the chance to sit back and think what's happened over the last 20 years and where we were and where we are now.
I guess your dream really would be BMI is no not used, that it's really this in its place, right? Because you get just so much more granular data and predictive capability. I mean, that's why doesn't the world shift? I mean, the possibility, the capabilities there technically. I guess that's one. So let's get to two questions here. I mean, what would you be your recommendations here to the audience? And then what questions do you want to leave the audience that, for the audience to ponder?
I think for me, going back to what we talked about at the beginning, I think for anybody out there who has children or grandchildren, uh, when we did all the analysis on the data of children, we found out that the biggest indicator of mean sizing was actually height, not age. So, that is a very good indicator where you have to have a constant of which you then measure a variable against that. And BMI in children doesn't work. Children go upwards and they go sideways at different times and at the same time. And I am a specialist in measurement of the human body. And in any measurement, you have to measure a variable against a constant. If you've got a drink and you drink some drink out of the glass, there's less liquid in the glass. That's your variable. The glass is the content, is the constant. And I think people just need to think differently about healthcare and about their body, because after the age of 18, height is the constant and your variable is your weight, which can go in any number of different directions. So I think, knowing and understanding that better, both for yourself and for other people, has got to be the right way that we should approach healthcare and our own health and that of other people.
So are there questions you want to leave the audience that they should ponder?
So, sorry, I missed that. Sorry.
Are there questions you want to leave the audience? So questions
Oh, because I
you
leave the
want them,
audience.
questions they should be asking, for example.
I think the question perhaps that I think the biggest question I think people should ask themselves is, am I kidding myself about the way I actually look? And the reason I'm saying that is because when we did the first national sizing survey for the UK government in 2001, we had to recruit men and women based on perceived size. And we found out that the women thought they were a smaller size than they actually were, but the men thought they were taller than they actually were. And I think we're all kidding ourselves, really. And I think when it comes down to healthcare, healthcare is a real leveler. And we all want to be healthier. We all want to live longer. We all want to understand more about ourselves to make sure that we can see our children grow up, see our grandchildren grow up. And I think that's where I think sometimes you need objective tools to help you with that process, because we kind of kid ourselves we're okay when we're not. And I'm the worst at that. So I think that's what I want people to think is, let's use tools that give my physician and my doctor or my GP a better understanding about me so they can make better decisions for me from that point onwards.
So, Richard, thank you for coming in. I mean, you've continued to grow what you're doing with MyBVI and the app for body volume index, and clearly there's a differentiation between that, the body mass index, and which is like 200 years old almost. So, and you got a lot more granular data, and all the technology exists. And the AI is powerful enough to give you all of this personalized predictive capability. And of course, always working with your health care provider. So, and it's easy, as you mentioned, two photos, basically using a standard smartphone replaces all of the kind of bulk equipment used to have or were required before. And that's because of all of this innovation you've done. So, in working with, as you mentioned, different entities and organizations around the world. So, Richard, thank you for coming in and sharing your insights with the audience.
Yeah, thank you, Stephen. It's really, really appreciate it. And thank you, everyone, for listening.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.